I'm Sarah Zabel, independent candidate for U.S. Congress in Idaho's 1st District, and I want to talk to you about healthcare reform. So we have a serious problem. We pay about 2.5 times what other developed nations pay for healthcare, and we have worse outcomes. We have lower life expectancy, and we have higher rates of preventable disease and illness. And that amount that we pay, in 2024, it was $5.3 trillion. That was 18% of everything the economy produced that year. And we can just expect costs to go up. The prediction is that costs for healthcare are going to rise higher, faster than inflation and faster than our economy grows, so that by 2033, we'll be paying more than 20% of everything the economy produces in healthcare costs. And that still leaves tens of millions of Americans without any sort of healthcare coverage at all. Now, you've probably heard about proposals like Medicare for All or single payer or public option, and those are very much well worth looking at. I'm very sympathetic to the goals. The goal is universal healthcare coverage, so everyone's covered. And not only that, but since everyone's covered in one system, it's simpler. It reduces administrative costs. It reduces some of the costs overall. But the problem is that most of those proposals are not laid out in detail, and the devil's in the details and in the assumptions that you use. So the one proposal that has been laid out in detail, it's been analyzed up and down, and depending on the assumptions, it either costs less than what we pay now, or it costs a lot more and strains our healthcare system and our pocketbooks even more than what we have now. Take, for example, assumptions about how much how much reimbursement is made for a Medicare patient on a Medicare for All. If you assume that the current rates prevail, then the system can pay for itself. But you probably know that there are a lot of hospitals and a lot of physicians who limit the number of Medicare patients that they take because it doesn't pay for itself. And especially here in rural Idaho, in the rural areas, our hospitals depend on private insurance to pay a lot more for every patient, for every service, so that they can afford to provide the services to the Medicare and Medicaid patients. Without that private insurance, without that higher reimbursement, they wouldn't survive. They're right on the edge, right on the margin right now. So if the current rates for Medicare and Medicaid were mandated for everyone, they wouldn't survive. So you end up with a paradoxical situation in which, yes, it's wonderful. Everybody is covered. Everybody has health insurance. But the problem is the points of care near you have closed. So yes, you're insured, but good luck getting an appointment anywhere. I support fixing the current system rather than throwing it away and trying something new. And we have a lot of problems. We have a lot of things to fix. A series of analyses shows that about a quarter of everything that we pay for healthcare is waste. And what I'm talking about are unnecessary and even harmful procedures and tests. I'm talking about hospitals that buy up physician practices and then raise rates and eliminate competition everywhere. I'm talking about pharmaceutical companies that use our patent laws to keep generics out of the market for decades. All of these are ways to reduce the basic cost of healthcare, even beyond the discussion of who should pay for it. And if we can reduce the basic cost of healthcare, it doesn't only help our pocketbooks, our affordability, but it also helps to extend healthcare coverage to more and more people because it fits better, it fits in our budget. So it might not be, it's not universal healthcare coverage, but it is greatly expanded healthcare coverage, and it's achievable. There are distinct steps that we can take to get there. For example, we can allow the Centers for Medicare and Medicaid Services to negotiate the prices of more drugs. Right now, they're allowed to negotiate, I think it's 20 different drugs. We can raise that number and let them negotiate the prices of more. We can extend the sort of services that nurse practitioners and physician assistants can provide. Right now, that's controlled by the professional services, the professional associations, and they limit it. Even though the body of evidence shows that services provided by nurse practitioners and physician assistants, in many cases, it's equivalent to that provided by a doctor. And we can also demand site-neutral payments. That means you pay the same whether you're seen at a hospital or at a physician's facility or at an outpatient clinic. Don't let them raise the rates just because you're in a hospital. So those are distinct, achievable steps that we can use to lower healthcare costs overall. And there's a lot more. This is a step-by-step process, but with achievable goals. And at the end of the day, it means that our economy works more for the people. We have workers who are able to work. They're not sidelined by healthcare issues. We have families, we have communities that are all healthier. And all of this, it's not pie in the sky. It's achievable. We know how to do this. Paid for by Zabel for Congress.